It's no secret that a growing number of Americans are taking antidepressants. An estimated 30 million people take at least one. According to the National Center for Health Statistics, the rate of antidepressant use has increased nearly 400% in the past 2 decades. The statistics, however, do not include the youngest group of patients being treated with psychotropic drugs. RT's Marina Portnaya brings us more about this alarming trend.
America has long been dubbed Prozac Nation for its heavy use of psychiatric medication. According to the Mayo Clinic, antidepressants are the most prescribed medications after antibiotics. And now a startling new finding shows that children, so young they still sleep in their cribs, are being treated with antipsychotics. According to the prescription data company IMH Health, 20,000 prescriptions for drugs commonly used to treat depression, schizophrenia, and bipolar disorder were written for children 2 years old or younger last year, a 50% increase from the year before. The research commissioned by the New York Times doesn't indicate how many children received the prescriptions. One child may have received more than one prescription, and we don't know the exact condition for which these prescriptions were written. There's been no clinical trials or published research on how antipsychotic medication could affect the brains of children under the age of 2. The reason? Well, experts say it would be too risky to even conduct a clinical trial on kids so young. Now, some experts interviewed by the Times presume that parents and doctors use the psychotropic medications to treat behavior problems like temper tantrums, which almost anyone would say is normal for a baby or toddler. But no medical professional has been able to justify the use of these type of drugs for young children who can't even form full sentences yet or may still wear diapers.
So doctors work from a medical model, like an x-ray. They look at the x-ray, it's black and white, it's clear. You see this, broken bone, you fix it. This is what you do. But with a child, especially under the age of 2, who can't speak and isn't able to communicate well, we're really guessing at what the issue is. And we don't know the function of that behavior. I much prefer a team approach. I think you need a multidisciplinary team because somebody else from a different perspective might see something in that behavior that a doctor working in isolation in an office might not.
Now, we need to be clear by saying that just because a prescription was written for a young child doesn't confirm that it was actually consumed. However, critics say that the pure fact that we're seeing younger and younger Americans, now babies, being advised to take medication indicates just how much drugs have become a first resort for many doctors. Marina Portnaya, RT, Miami.